Hi, my name is Dr. Borsellino, and I'm one of the residents at the Family Medicine Center. I'm here outside the radiology department to talk to you about osteoporosis. Osteoporosis is the thinning and loss of bone mineral density in your bones. So when your bones get porous, then you develop osteoporosis. Now, you may be wondering why I'm here outside the radiology department, and that's because we screen for osteoporosis using DEXA scans. But I'll talk to you about that later. In the meanwhile, let me show you what it looks like under the microscope. Under the microscope, healthy bone looks somewhat like a honeycomb. In osteoporosis, the holes and spaces in the honeycomb appear much bigger than those found in a healthy bone. This is a DEXA scan. It's a non-invasive test that looks at your bone mineral density to see if you've got osteoporosis or if you're at risk for fractures. It uses 2 X-ray beams aimed at your lower spine and hips, and it's a highly accurate test. It really only uses a minimal radiation exposure in order to get you all these results. Now, you may be wondering, are you even eligible to be screened for osteoporosis using this beautiful machine? Multiple organizations actually recommend that 65-year-old females and 70-year-old males with no risk factors be screened using the DEXA scan. 60-year-old females with risk factors, on the other hand, should be screened a little earlier. There are some unchangeable risk factors. For example, women are much more likely to develop osteoporosis than are men. Aging is also a risk factor. You are at a greater risk of osteoporosis if you are white or of Asian descent. Having a parent or sibling with osteoporosis also puts you at a greater risk, especially if your mother or father experienced a hip fracture. Men and women who have small body frames are also at a higher risk. Other risk factors include hormone levels, dietary factors, steroids and other medications, certain medical conditions. Some bad habits can also increase your risk of osteoporosis, including a sedentary lifestyle, excessive alcohol consumption, and even smoking. At your next visit, ask your doctor if you're at a higher risk of developing osteoporosis. They can use a risk assessment calculator to check and see what your 10-year fracture risk is. They can also see if you need to be screened sooner. They can also tell you how to prevent osteoporosis and give you all the tools and tricks and tips to take care of yourself.